Okay. How to approach examination? कैसे approach करोगे आप? How to approach examination? So, I have question with you. What is expected in examination? What is expected in examination? After the immense hard work at orthopedic residency program and practical experiences spree, it is difficult to put forward the argument in favor of a 1 or 2 day assessment of the candidate deciding his fate to procure degree. Everyone has to still undergo the same stereotyped manner of judgment deciding one's fitness for the degree. Nevertheless, it is a matter of fact that the examiner have also undergone the same course over the years, making it easier for a candidate to pass examination. If it is taken in its true perspective, which is often unknown, candidates often find it an uphill task to please the examiner in examinations for want of understanding of the main purpose of examination and the desired perspective. The following points are projected to give an outline about what exactly is expected from candidate. The way a candidate approaches the patient. The way a candidate approaches the patient. This should ideally be reflected upon as a firm but sober and professional approach to the patient. Always remember to be gentle and kind. Be keen, be confident, be smart, be professional. It is not too much an ask. It's not too much an ask. Give patient enough time from your stipulated time. Do not be thrift. Believe me, it helps. Sometimes you will find that the patient tells you the diagnosis. Explain every procedure to the patient and confirm the doubtful point to streamline your history-taking part. Follow the basic norms such as to examine the normal side first for comparative assessment, etc. Always pay particular attention to the surrounding, footwear, assistive appliances, and make a note of them before starting your probation. This will tell the examiner that you know how to start solving the problem. The way a candidate approaches the given problem. The way a candidate approaches the given problem. Perhaps the most difficult part in the absence of practical experience. Good judgment comes from experience and experience from bad judgment. A hand-on experience in outpatient department which is often time constrained and theory and academic classes give excellent opportunity to present patient to well experienced consultants who are surely examiner for other and possesses immense experience. Never flee away from them. Mistakes teach you the most. The biggest fault of life is to think that you have none. Word round and patient workup immensely help develop one skill. Examination anxiety imposes a sense of hurry and uncertainty about cases throughout disarray in approach, which is often striven in the end by quick fix solution that indeed jumbles up the problem, turning on the vicious cycle. Always attempt to develop a unique but well manageable and adequate approach for most common cases. Regular practice should make one comfortable in examination. The way a candidate presents the problem and his viewpoint. After examining the case, which appear to be the true encounter whereby you will be assessed regarding to your capability to communicate with the examiner about the case. For this, you should be a part orator, part clinician, part politician. You should be smooth and focused in presentation with tactful representation of the fact leading to diagnosis, but not projecting at the same time to the examiner that you are biased by diagnosis. Biased by a diagnosis. Keeping your mind open to anything and be prejudiced for criticism. The understanding about the given problem and possible solution. Always answer to yourself in the following sequences of the problem and solution. What is the problem? What can be done? Why should it be done? When to do it? How to do it? What? Why? When? And how? Just make a diagnosis in long case and particularly in short case does not surprise the assessment. One is required to know the basic etiopathogenesis and management perspective of the same. Particularly for some cases, being a specialist in the field, you may even be asked of the popular theoretical perspective. So you also need to be an historian. The treatment or management option you give require that you know fully about them and that it should fit the case. Do not beat around the bush. Take your time. No one will fail you for their being sloppy if your answers are correct, as even the best clinicians are perplexed sometimes by simple problem in unusual circumstances. Explanation of the most common solutions. You should be the boss of the most common procedure performed. Any question asked right, left or center should be answered with the ease of cutting butter with a spoon in summer. How to prepare for examination? This is shortest written portion of the book, especially reiterating the fact that it's an individual way of learning. However, there may be some advice of help. Refer and follow the standard practice. Number 1. Continuously practice and revise the important cases. Be focused. Develop communication skill. Difficult but of tremendous help. Most candidates who fail are just unable to express what they actually mean, although they are correct in essence. Do and don't in examination. There are a few things that should be done and more importantly few that should not be done. What should we do? Do is be calm and patient. Be tactful but considerate. Be clear in perspective. Be confident with apt knowledge. Be frank. Accept your mistake if pointed out. Be flexible, open-minded. Finish with a smile to patient and examiner. Don't be in a hurry or anxious or overzealous. Don't try to be clever. Don't try to jumble up problem or become a researcher with innovative ideas. Don't mess up with fact or try guessing work. Don't be overconfident and arrogant. Don't be dominative. Don't be argue. Don't show disappointment or frustration over disagreement. Don't make hasty conclusion. How to read this book? A concise yet comprehensive attempt to recreate the question may make some aspects of the book difficult to grab. It is well accepted that basic concepts regarding the management and diagnostic perspective differ depending upon the personal and practiced or algorithm by various experts. You too may differ in the various respects, being amateur in the field. Information consists of difference that make a difference. The book definitely does not give a holistic approach to all the cases, but is a willful attempt to introduce the basics for revision with address to some intricacies of the cases that may need further refinement according to the local practice. It is imperative that at the important juncture of examination one need support from internal examiners who are basically internal experts and would be able to better explain the locally practiced protocol. I would appeal the reader to go through the book as it is once and then practice the cases. Mutual group discussion over particular problem make fundamental clear and easy to grab. Do not be in illusion by illegitimate concepts that are unacceptable. The book has been prepared after considerate and careful analysis of the various standard texts. More than 21 textbook and review paper more than 650 that are acceptable to most by and large. The acceptability threshold may, however, differ. The concepts given are standard for orthopedic practice, but personally I will prohibit quoting of the text or concept or guideline given herein. One should adhere to a standard textbook or reviewer to this rescue. I feel here to reiterate that the fact that what is written in this book is not a hypothesis or personal research work to give a sense of security to the reader. You will gradually come to know the source for manuscript while reading your textbook. The read time are calculated approximation depending upon the general practice and exposure of graduate, complexity of topic, importance of topic, and compactness of information provided. This in general hold true, but exceptions are a rule. So one may diverge considering his own knowledge local. So one may diverge considering his own knowledge and exposure and local prevalence of particular topic. Soldier may be omitted fully while he may read 20 times. Example. General flow of question in examination does not necessarily follow the pattern given herein, and in a virtually realistic examination it is found to be differ. But one is always question of the reason for giving a particular diagnosis, possibly differential diagnosis with reason, management protocols, etc. But that is primarily stressed upon in this compilation. Some stereotyped questions are oft repeated like, what will you do next? The answer to which is often wrong in an anxious environment and will hence be found in most of the chapter, so that it becomes a habit of candidate to correctly reply the same as it is the watershed between the diagnosis. Consider less important part by candidate and management more stressed part. Try reading the chapter from beginning unless revising particular concept, as continuity has been especially dealt with. Otherwise, some concepts may be overlooked. Teaching notes or text in italic is often ancillary and sometimes includes controversial. Sometimes include controversial. An unsettled issue needing individual judgment for acceptance. Lastly, where a large amount of knowledge is presented with alternative procedure, the underlined text serves as the standard or most commonly followed method, but is again subjected to individual assessment for want of standardization. In spite of the best effort, one may not accomplish the desired. The disheartening fate dictates some lapse in fundamental approach which all cannot be laid down in a narration and entails experience. Remember here, do not just turn grey in sun. Experience enables you realize a mistake when you make it again. I surely do not mean that one need to fail to understand the cause of failure, but it should be emphasized that prevention by a masterly carved approach pay reward. There is no shortcut to success, and exhausting effort with indelible persistence is required to become a specialist. Destiny is a matter of chance but of choice, and choice is still yours till you have to face examination. You can achieve what you want. You can achieve what you want with a good strategy. Strategy building is not just a subject of fighting war or winning elections. Remember those times you devised time to see a movie or attend friends' marriage by quickly shuffling day's work. That is also a strategy.